Do you know that sugar is one of the primary sources of the body's fuel and that diabetes is also a condition that children can have? Welcome back to the LUTH Podcast. Today our episode is going to be on World Diabetes Day. So what does diabetes in the workplace look like from a pediatric endocrinologist perspective?
Ideally, in the workplace, they should be empowered. They should not be stigmatized. They should have the opportunity to exhibit their full potentials despite the disease that they're managing.
Rice, amala, fufu, ewedu, and egusi. Do you think people with diabetes should avoid these foods?
Sugar in itself doesn't really cause diabetes, but can predispose you to an increased risk of having diabetes.
Diabetes that is not diagnosed and managed on time can actually lead to the death of a child. And so we talk about warning signs. We summarize it in what we call the 4 T's.
My name is Moyo Ojawumi. I'll be your host, and today with me I have Dr. Oyenusi, who is a Consultant Paediatric Endocrinologist. Thank you so much for being here with us, ma'am.
Thank you for having me.
Okay, so we'll be going right into our icebreaker session just to loosen up the mood a little. So for our first question, can you tell us why you chose to become a pediatric endocrinologist so that we may get to know you better?
I'm Dr. Elizabeth Oyenusi. I'm a consultant pediatric endocrinologist in the Lagos University Teaching Hospital. I'm also an associate professor in the College of Medicine, University of Lagos. And after specializing in pediatrics, I realized that children with endocrine diseases in Nigeria and Africa were not getting the needed care. So I decided to undergo the training so that I could provide the care these children need.
Okay, thank you so much, ma'am. So for a bit of an icebreaker question, what hormone in the body do you think deserves to be a superhero and should be in a superhero movie?
Okay, talking about superheroes and hormones, I would rather talk about the fuel in the body, which hormones act on, which is glucose, which on the street we call it sugar, because every cell in the body needs glucose to be able to function. All our organs, the person as a human being needs glucose for their organs to function, their heart to beat, everything for you to move. So glucose will be the fuel I give the superhero movie to.
Okay, thank you. So what's a typical day like for a pediatric endocrinologist and what's your favorite part of it?
Okay, so as a pediatric endocrinologist in a day, I will manage children who come in with growth problems, some children who are not able to grow, some children who have problems with their thyroid glands because the thyroid gland is involved in a child's brain development, a child's intellectual functioning. Sometimes also some children are born with their genitalia, you will not be able to know whether the gender is not clear, whether they're male or female. So those are the kind of cases I treat. But the highlight of my day will be managing a child who comes in emergency because they have complications from diabetes, what we call diabetic ketoacidosis. Such children come in coma, they come in almost dying, but when you do what you're supposed to do and monitor them very well, within 48 hours, they are up and about asking for food and running around. That is very rewarding for me.
Thank you very much for letting us in on that. So now we'll be moving into the nitty-gritty of this interview. We'll be talking about diabetes proper. So diabetes is typically seen as an adult disease that has to do with overconsumption of sugar, but we've seen it in children too. So we want to know if it is mostly genetic or if there are other lifestyle factors involved.
Okay, so diabetes in children, the common type of diabetes in children, which is type 1 diabetes, it's not gotten from overconsumption of sugar or overconsumption of calories. It's gotten because a child is predisposed to that because of their nature. It comes from their genes, and then environmental triggers, when something in the environment, maybe they have a cold or they have an infection with a virus, then they can now come down with diabetes, type 1 diabetes. But because now recently we're seeing that many children get obese too, and they get overweight, they can't get the kind of diabetes that adults have, which comes from overweight, which is type 2 diabetes.
Okay, so diabetes in children is a mixture of genetic and lifestyle factors.
Exactly.
Okay, thank you. So what does diabetes in the workplace look like from a pediatric endocrinologist perspective?
So from my perspective and from the patients I manage, diabetes in the workplace, first of all, because we have adolescents and young adults who work. And so we One, that ideally in the workplace, they should be empowered. They should not be stigmatized. They should have the opportunity to um, exhibit their full potentials despite the disease that they're managing. It means that the people, the colleagues at the workplace, should be knowledgeable about the disease, because some of them sometimes have to take injections for the disease, and they should not misinterpret it as being that maybe they're abusing drugs. Also, sometimes when they get complications, because sometimes the treatment for the diabetes may make their blood sugar go down, they may faint. Sometimes they may even convulse, so that they do not label them that they have epilepsy. And for the younger children we manage, their workplace would necessarily be the school that they attend. And the parents of the children who go to the school, their peers in the school, the pupils, the teachers, everyone should support the child with diabetes, and then support them, not stigmatize them, because sometimes they may have to go and take their injection before they eat, and so many other things that relate to minute management of the disease. So diabetes in the workplace, what we're advocating for is that the person with diabetes should be given full support to maximize their potential, like any other person that doesn't have diabetes working with them.
Thank you. That was very insightful. So for our next question, we'd like to know if diabetes is a disease that can lead to death in children. And if so, what are the warning signs that parents should look out for in their children?
Yes, thank you very much for that question. Diabetes that is not diagnosed and managed on time can actually lead to the death of a child. And so we talk about warning signs. We summarize it in what we call the 4 T's. The first T is a child who is always tired, unusual tiredness. In fact, sometimes the parents might think that this child is trying to be lazy, because when they send them on errands, the child is just weak. They might call the child lazy. It might just be that the child is unusually tired. The second T is a thinner. The child is losing weight. Despite eating well, the child is losing weight. The fourth one is that the child is always thirsty, drinking a lot of water. And then the last T is that the child goes to the toilet a lot, meaning the child is going to the toilet to pee. Also, it could be seen as bedwetting. A child who had already stopped bedwetting, because children, when they get to a certain stage, different ages for different children, they will stop bedwetting. But a child who had already achieved what we call continence, meaning that the child has stopped bedwetting, who now resumes bedwetting, it may be that that child has diabetes. And for children in the rural areas as well, we add that who pee outside. When when a child pees and then we see that ants gather around the child, then that's also a warning sign of diabetes. Then I must also add about children who cannot talk. They're wearing diapers. Sometimes the mother may notice that the diapers are always full. They have to change the child diapers frequently. And then sometimes because of thirst, the child is always crying, cranky, irritability. So those are the warning signs. And if a child is brought in on time and we start treatment, then the child will not go into complications like diabetic coma, which may lead to the death of the child.
Okay, thank you very much. So some of our warning signs are the 4 T's: thirsty, tiredness, the child goes to the toilet a lot, and the child is getting thinner. Thank you very much, Ma. So for our next question, how has the management for diabetes in Nigeria evolved over the years?
Thankfully, we're grateful for where we are, although we're not where we want to be, because in the past, insulin was very expensive and unavailable for children with diabetes. And then later on, the ones that were available didn't really fit into the lifestyle of children with type 1 diabetes. But now we have insulin available for them. And for those that cannot afford, there are different donors that have made it possible for them to have access to insulin. And then sometimes some of them also have access to blood testing kits, what we call glucometers, to check, because they need to check their blood glucose. But we're not where we want to be, because in the developed world and in many places that they have insurance, children with diabetes get insulin pumps where they do not have to inject themselves 4 to 5 times a day for their insulin. They just attach a catheter and the insulin is delivered. And also we have what is called continuous glucose monitor, CGMs, where children attach it to their body and it reads of their blood glucose and shows it on their phone or on a desktop. But our children still need to inject 4 to 5 times a day, and when they want to check their blood glucose, they have to prick themselves. And we are hoping that those equipment and things can be made available for the children with diabetes in Nigeria.
So there's still some progress to be made, but it's
Ex-
nice to know that some things still are working.
Exactly. We still have a lot of grounds to cover.
Thank you so much for this insightful session. So before we wrap up this particular segment, would like to ask you that what advice would you give for somebody living with diabetes or somebody who has a relative that lives with diabetes?
Okay, so the first thing I would say is that diabetes is not a death sentence. Okay, so when someone is diagnosed with diabetes, it doesn't mean that their life is over. Once it's managed very well, they can grow up to their full potentials. We have children who would manage from childhood, who have gone to university, they are working now, some are married, some have their own children. And so with support from the system, the health system, their parents and relatives, they're able to achieve their full potential. And for the relatives of people who have diabetes, they should also encourage them to live healthy lifestyle, regular exercises, eat the right food that will make their diabetes control to be optimal.
Okay, thank you very much. So we're coming to the end of this segment, and to wrap things up, we'll be playing a blitz round. So I'll be asking you a couple of questions, and you just have to say the first thing that comes to your mind. So are we ready? Okay, so coffee or tea?
Tea.
Morning or evening?
Morning.
Books or podcasts?
Books.
Local or intercontinental?
Intercontinental.
Okay, thank you. That was very fun. Okay, for the last question, if you were not doing what you were doing now, what would you do instead?
I'll be a fitness coach and a dance instructor.
All right, thank you so much. That was a very engaging session. So we've come to the end of this segment. Thank you so much for staying with us to the end, and we hope to see you on the next episode. Thank you. Good day, everyone. Welcome back to our episode on diabetes and the workplace. We'll be continuing our conversation with Mrs. Pat Chima-Madubuko, who is a dietitian. Thank you so much for joining us today, ma'am.
Thank you for having me.
Yes, ma'am. And my name is Moyosere Ojeomi, and with me I have...
Oyenusi and everyone. So we'll be getting to know our guest, Mrs. Pat. Can you tell us a little bit about yourself and why you chose to be a dietitian?
Okay, I'm a registered dietitian nutritionist, and my interest in being a dietitian spans from passion, the love for food, its science, how it heals, how it treats, and how we can make people have good quality of life.
So food is life, in essence. Thank you, Ma.
Okay, so Mrs. Pat, let's be honest. Do dietitians ever eat junk food?
We practice what we preach. But we're humans, you know.
Yes.
But we're very careful, basically.
Okay, so there's no time I'll see you with a bottle of Coke in your hand.
Nah.
Okay. So do you have any guilty pleasures when it comes to food? Ones that your patients will be shocked to see you eating?
Okay, like I said, we'll try to practice what we preach, but then once you have the knowledge of what is good and what is not good, so you tend to do the good part. So I don't have any guilty.
All right, thank you so much. Those were very fun answers. Now we'll get into the nitty-gritty of the interview.
All right, diabetes and the workplace. Ma, can you tell us what the role of a dietitian is in management of diabetes?
Okay, so diabetes is a multidisciplinary, requires a multidisciplinary management. So you have medication, you have diet, you have exercise, generally a lifestyle modification. So diet plays a huge role in that what you eat must be equal to the amount of medication you're taking, and the amount of medication you're taking should be able to work on the amount of food you're eating. So it's very important in diabetes.
So you consider balance important. What you eat and the medication as well.
So we'd like to know, what's the real relationship between sugar and diabetes?
Okay, sugar in its entirety is not actually bad, but then like people believe, oh, when you eat sugar you get diabetes. That's not actually true, but you can have an increased risk of having diabetes if you take in excessive sugar. So what it means is that when you take in excessive sugar, you can gain weight, you can have obesity, which increases the risk of having diabetes. So there are other things. When you have increased fatty liver, you can also have increased, which leads to increased risk of having diabetes. Sugar also causes some form of inflammatory responses in the body, which can also increase your risk of having diabetes. So basically, sugar in itself doesn't really cause diabetes, but can predispose you to an increased risk of having diabetes.
Okay, thank you very much, ma. So sugar is not the bad guy. We just have to take it in moderation.
Exactly.
Yeah.
All right. So we know about herbal concoctions like agbo, commonly used in this part of the world. What do you think about it, and does it cure diabetes as most people believe?
Okay, so for now, diabetes doesn't really have a cure. So the agbo really will not cure diabetes. Diabetes can only be managed. So they are basically myth or misconception in the society, but a good medication, good diet will help you manage and keep the blood sugar within normal range.
So agbo is not the cure to diabetes.
Not at all.
Okay, so many Nigerians, myself included actually, think that fruits are safe and sugar-free. Are there any fruits that diabetic patients should avoid and why?
Well, so fruits is very important, but moderation is the watchword, and moderation is key. So people living with diabetes can actually take fruit. So the fruit is regarded as their snacks in between meals. So they can have it in between their meals, and they can have it twice or thrice, depending on the prescription that they are allowed, or if they're on insulin or they are on oral hypoglycemic drugs and all of that. So that determines how it is how it is distributed. So they can actually have fruit, but then remember, quantification and size comes into play.
Okay, so we should take our fruits, but take them in
Moderation.
moderation. Yeah, thank you for that, ma'am.
So we have a lot of delicious local foods, and do you think people with even diabetes should avoid these foods like amala, fufu, ewedu, and egusi, and rice? What do you think?
So there's really nothing called special diabetic diets. This is the diabetic diet. So people living with diabetes can eat every food, and this is what we preach, that you can eat every food, but in moderation. So it has to be quantified. So if you meet your doctor and you make a prescription of the calories, the dietitian transmits the calories to regular food and the quantity you can have of them. So you can actually eat all the food, but in a particular amount, and except what we call the simple sugars. The simple sugars are the things that do not require digestion. The body just absorbs them, and they have the ability to spike up the blood glucose level. So which examples are like sugar, honey, sweets, pastries, and all of that. So they are actually out of the diet, but the regular complex carbohydrates can be eaten, and then in the quantity that is recommended for an individual based on age, weight, size, and the activity the person is open to.
I'm glad to hear that. At least I know nobody is missing out on these delicacies.
Okay.
Thank you for that, ma. So, as a typical Nigerian, how can we enjoy all these meals that you've mentioned without diabetic patients harming their blood sugar levels?
Okay, so like I mentioned before, modification is the key word. So once you have been diagnosed with diabetes, it's important to see the experts, the endocrinologist. Of course, the endocrinologist will refer you to the dietitian, who would help you translate, tell you what to eat, what not to eat, how to eat them, when to eat them, and the quantity you should have of them. So that is where carbohydrate comes in, carbohydrate counting comes in to determine the amount of carbohydrates you can take. So basically, you can actually enjoy your meals, but it has to be done with the aid of with the help of a dietitian to guide you on how to eat them and when to eat them and how much to have of them.
Okay, thank you. It's actually reassuring to know that they don't have to be on strict diets.
Yeah.
So what's one myth you wish Nigerians would disregard about diabetes?
Okay, eat beans, 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 and beans. It's a huge challenge. So there, people believe that when you eat something bitter, it would cancel the sugar in your blood. Or when you eat only beans and beans products, your blood sugar will remain normal. Or when you eat unripe plantain. So these are generally myths. But what we don't understand is unripe plantain is complex carbohydrate. So the difference between an unripe plantain and a ripe plantain is just that ripening process. So unripe plantain contains complex carbohydrate. The ripening process converts the complex carbohydrate to simple sugar. So which is why when you taste your ripe plantain, it is sweet. So, but then everything, because it has, but then even if you eat your unripe plantain, when it's broken down, it's going to be broken down to sugar. So quantity matters. It's not something you can eat freely. And then people believe that, oh, beans is protein, and because it's protein, you can eat it as much as you want. But the truth about it is that every food contains all nutrients, but it depends on the quantity, and amount that it contains. So beans, we know, is a protein source, but then it also contains carbohydrate, about 50 to 60 or 75% of carbohydrate. So if you eat beans excessively without measure, it will end up increasing your blood sugar. So whatever you want to eat, be it beans, be it rice, be it a ripe plantain, it must be measured so that your blood sugar is within the right level.
So, in essence, proper proportions of these foods is important.
Yes.
Right. So some people believe that once they start their medications, they don't need to watch their diet anymore. Is that actually true?
Well, that is not true because too much medication and little food can lead to low blood sugar, and too much food with little medication can also lead to high sugar level in blood. So there must be a balance. Once you have your medication, your diet must also be checked, and once you have your diet, you also must, ensure you take your medication.
Thank you, Ma. So this is further stating the points that balance is key.
Now, moving into a special segment called Myth or Fact. I'll be seeing some statements and you let us know if it's a myth or a fact. Okay. First, eating too much sugar causes diabetes. Myth. People with diabetes cannot eat any simple sugar.
Fact.
Only overweight people get diabetes.
Myth.
Diabetes isn't a serious disease.
Myth.
Non-diabetic or sugar-free foods are always safe.
Fact. And if it is actually sugar-free.
Diabetes is a disease that runs in the family.
Fact.
Drinking a lot of water can flush out excess sugar and cure diabetes.
Myth.
Honey or brown sugar is better than white sugar.
Myth.
So as we come to the end of our episode, we'd like to ask our esteemed guests, what is it like being a dietitian in a country like ours, where it seems like not everyone has enough knowledge about it or even really cares about their diets?
Okay, so it's quite interesting and challenging. Interesting that you're able to make changes in people's life. You're able to give them information that will improve the quality of their life, especially when it comes to food. They can enjoy their food despite the disease condition. Challenging is in a way that everybody is an online dietitian. Those that are certified and those that are not qualified can randomly give advice on nutrition and what people can eat. So which is also a huge level of problem. And of course, we cannot underemphasize the uncensored information you have in social media, which is also affecting people and their health. And so this is using this medium to make a clarion call to the president of the country to ensure that the Dietitian Council bill that has passed and awaiting the presidential assent can actually be given assent on time so that these things can be regulated, and then we could have a safe environment and people can get qualified or censored and evidence-based information about their nutrition and then help improve their quality of their life in general.
Thank you very much for that response, Mike. It was quite insightful.
Thank you.
Thanks so much, Ma, for joining us in this episode. We've learned so much about diabetes and how it affects people and how best it can be managed. Thank you.
Thank you very much, Ma.
Thank you for tuning in to today's episode of LUTH Podcast. We hope you enjoyed it as much as we did.
Look forward to seeing you in our next episode. Remember, like,
comment, and share.
Thank you.